So a facility assessment, it is a tool that skilled nursing facilities use for many purposes, including determining staffing ratios for the skilled nursing facility. And again, although acuity is referenced in the federal regulation addressing the facility assessment, which is CFR 43.70E, there's no specific formulation or definition for what acuity actually is. So under this regulation, the facility must conduct and document a facility-wide assessment to determine what resources are necessary to care for its residents during both day-to-day operations and emergencies. So there's that word emergencies. COVID-19 presented an emergency situation. So we anticipate that the facility assessment is going to get increased scrutiny by the government. The facility must review and update the assessment as necessary and at least annually. And the facility must also review and update whenever there is or the facility is planning for a change that would require a substantial modification to the assessment. The facility assessment has many different parts, different areas that have to be addressed. And I will just go over a few of them for purposes of this presentation. So the facility's resident population, including but not limited to both the number of residents and the facility's resident capacity, must be addressed. The care that is required by the resident population, considering the types of diseases, conditions, physical and cognitive disabilities, overall acuity. This is the portion of the facility assessment that addresses acuity, and other pertinent facts that are present within that population. The assessment must also address staff competencies that are necessary to provide the level and types of care needed for the resident population, as well as the physical environment, equipment, services, physical plant considerations that are necessary to care for the resident population, and as well as any ethnic, cultural, religious factors that may potentially affect the care provided by the facility, including but not limited to activities and food or nutrition services. The purpose of this assessment is to determine what resources are needed to best serve the needs of the resident population, both for daily operations and in cases of emergencies. So with COVID and the type of emergency situations that it presented, skilled nursing facilities should expect increased scrutiny on the facility assessment, that proper analysis is being done in the assessment, and then as well, that the plans from the assessment are being put into place. So the assessment takes into consideration the facility's capacity, its resources, its services, each resident's overall acuity, among other factors. And the facility assessment contemplates that various individuals will be involved in preparing that assessment. At a minimum, the administrator, a representative from the governing body, the medical director, and the director of nursing should be participating in the drafting of the facility assessment. And as I stated, assessments should be reviewed and updated annually, or when there is a change, in the facility that would require a modification to the general assessment process. So for instance, if there's plans to admit residents that require substantially different care than was required previously. CMS does offer assessment tools, and they are available at that link on the bottom of this slide. CMS facility assessment tools suggest the evaluation of resident profile, which would include the number of residents, diseases and conditions, physical cognitive disabilities, acuity, and ethnic, cultural, religious factors that could impact care. Also would include evaluation of services and care offered based on the needs of that resident population, and facility resources needed to provide competent care for residents, including staff, staffing plans, staffing training and education, physical environment, building needs, agreements with third parties, health and IT systems, risk assessments, and further resources.